Hey guys, this is one of our most recent cases. She was a long-time patient a long time ago. It took a very long hiatus between her adjustments. And what brought her back in? A pretty solid AI sacrum. That's going to produce a lot of sciatica type problems. And this presentation of the sacrum has been associated with a lot of coronary problems like heart issues because of the way that it stresses the spine and causes the spine to rotate. And that changes what's called the mediastinum, or where the heart and lungs are in the rib cage. All starts from how this is going on. Now, she came in with low back pain, and after about 3 months worth of care, this is what she looks like, right? And so now we have this reduction of that AI sacrum, and the spine, instead of trying to compensate hard back to the center, it's actually showing off a nice line that way. So that's been straightened out. Now, where did all this come from? Because we didn't spend a lot of time in the grand scheme of things on her low back and her pelvis. We spent most of our time in the neck. And so her atlas, which is the first bone up here, was the one that was causing all of her issues, because once the atlas is that misaligned and that subluxated, that's what creates a lot of the structural or biomechanical stresses, and the body compensates in other ways. There's a very strong correlation between atlas alignment and health and sacral alignment and health. And so when we were focusing on correcting her subluxations, we were focusing in on a lot of the time on her atlas, which this is where she started from. And as you can see here, this is where we ended. And so by aligning her atlas and making sure that we were correcting the subluxation when it was present, not only were we able to affect headaches, which is very commonly a symptom associated with atlas subluxation, but that is what allowed the rest of her spine to begin to unlock. And we ended up being able to have a pretty significant correction in her low back and her pelvis, when realistically we spent more time in her neck than in her low back. So just because you might be barking down there doesn't mean that that's where the problem is. Subluxation-based care means we find the cause of the issue, not where the symptom is. And if all you do is chase a symptom, you're not going to get it all the time. But when we choose to look for the cause and correct the subluxation, the body heals itself. The innate intelligence of the body knows exactly what to do, and we're just helping to facilitate that process. So another successful outcome. We're very happy that she's continuing with care to maintain what we've already done and to continue to progress through more correction.